So, you've made it through the first day of class. You realize that you're going to have to start changing your mindset. See, transitioning from high school thinking and testing to actual critical thinking and critical judgment requires a lot and can be challenging. But with the right mindset and strategies, you really can excel in this new academic environment. So, here's some tips we're going to use to kind of help smooth that transition for you. So, understand what that shift is going to be. It's going to be really important that you recognize that nursing school requires a different approach to learning. In high school, you may have focused on memorization and regurgitation of information for the exam. So I took it all in. I need to know what I do. I want to take that exam. Done. I don't need it anymore. But in nursing school, critical thinking and critical judgment are emphasized, requiring you to analyze, synthesize, and apply knowledge to real life scenarios. When it comes to memorization, there's going to be some parts where that is going to be useful, but you won't be able to get rid of that information. Everything is a building block. So when you learn something, you build on it, and you'll carry that to second semester and build on it, and carry it to third semester and build on it, and carry it to fourth semester. Next, it's really going to be important that you embrace active learning. I know it's going to be difficult, but it's really important that you move away from passive learning methods and engage in really active learning strategies. So instead of just reading a textbook, you're going to participate in class discussions. And it's really important that that reading a textbook happens before you get there. And understand, I'm not expecting you to know it all. We're not expecting you to know it all. By reading through the material, you can highlight the areas in which you say to yourself, this doesn't make sense. Or this makes sense, but I don't understand this. And that way, when you come to class, if your teacher is giving you instruction, or while she's giving you instruction, you're going through that material and you go, oh, yep, I remember that. Oh, no, wait, this is the area where I'm not doing so well at. Let me see if I understand that. And if it still doesn't make sense when your instructor goes at that material, then you can raise your hand and actively participate in class discussions by asking questions. And then give your thought as to what you thought. Allow your mind to be changed over. And yeah, not everybody's good at raising their hand. However, feel free, write those notes, bring them to your instructor and allow them to give you back that feedback. Seek out opportunities for hands on learning. So, whether it be simulations, whether it be using case studies, looking at your clinical experience, use all of those to enhance your critical thinking skills. And I want to recommend, although I do not endorse any one publication, I do recommend that if you get your hands on a really good book that breaks those questions down for you throughout, getting you to understanding and creating yourself a laundry list of things you don't know so that you know what to focus on. When you don't do those reading beforehand, making notes of what you don't know, getting that explanation and writing yourself notes on doing those lectures, you don't know what to focus on in studying. So you end up focusing on all of it and then becoming overwhelming. If you only study those things that you thought were complex or that you didn't understand and only focus in that area, then you can really enhance that critical thinking skill, putting your focus where that attention needs to be. Develop an analytical skill. So I want you to start honing in on being able to analyze information, really critically looking at that information that's being presented to you in class. So, as I mentioned before, using practice questions, evaluating your evidence, and then identifying biases, making sure that maybe you're not bringing in workplace experience, maybe you're not bringing in something that someone told you, even if I told you. I want you to get in the habit of of challenging what you're learning in class by what's in your textbook. Bring it to our attention if we made a mistake. Well, to err is human, right? So then I want you to also look for patterns, connections, and alternative perspectives to help develop a more comprehensive understanding of the subject matter. Now, seeking resources and support. I really want you to take advantage of the resources that are available to you in your nursing program. Tutoring services, study groups, academic support centers, podcasts are going to be at your fingertips. Reach out to your professor. Reach out to your clinical instructor. When you are in class and you're receiving that information from your professor, after you've read it, you've connecting what she's giving you in class, and you're like, okay, this all makes sense. And sometimes, even though it makes sense, you really don't get that really good, rich connection until you go into your clinical experience and you're actually taking care of a patient. And so when you see those things connect, ask your clinical instructor. Ask your clinical instructor to confirm what your mind is telling you. Write those notes down. Keep that pad with you. Because even if your clinical instructor can't really make that connection for you because they weren't in a class with your theory instructor, take those notes back to your course instructor and say, hey, today you were lecturing on this. I saw this in a clinical setting. Does this match up with what we're learning? And then get that feedback from your instructor. And then talk to your fellow nursing students. Look to them for guidance as well and clarification when needed. Collaborate with others can really help you develop those critical thinking skills. It helps each other like challenge what they're thinking through that discussion and then being able to see those different perspectives. In some of your nursing programs, you might see something called concept mapping. And I think concept mapping is really how you put things on paper. And I really do think that there are different types of learners. You have your audio learner, your visual learner, and then you have that person that needs to be hands on. But when you take that concept map, regardless of how you do it, that concept map is your way of making connections to those concepts that are being taught in class. It's a real good, powerful tool that can help you visualize the relationship between the concepts and then that critical thinking ability. So you're going to create concept maps connecting those various nursing concepts. You're going to identify their interdependencies there, and then you're also going to like write down how you understand how this contributes to the care that you're going to give the patient. Step 6 is about practicing clinical reasonings. And I know I didn't do it before, but I'm taking you through different concepts and we'll review them again towards the end. But with step 6, practicing that clinical reasoning. Clinical reasoning is that critical thinking in nursing that revolves around looking at information that you receive, analyzing it within either your patient scenario within a case study or your actual patient that you're taking care of. Then you're going to be identifying relevant cues. Then you're going to prioritize those nursing interventions. You're going to use that to make sound clinical judgments. And then reflect on your clinical experience. Look at feedback that you receive from your instructor to help you prove that clinical reasoning skill. And if you haven't already heard, NCSBN is really moving towards that clinical judgment piece in which they take into consideration 6 functions. One is about looking at the patient, the information about the patient, recognizing what those cues are, then taking those cues and analyzing them and prioritizing them based on what's important. And these things you'll start to learn. These are things that you're going to learn. And then you're going to be expected to generate solutions, take actions based on that, and then evaluate what you've done. And so these are all a part of that process that you're going to be embracing on your first day. These are your stepping stone blocks that you're going to have in that fundamental portion of your nursing program. When you're done, whether it's in the classroom, whether it's in the clinical experience, whether it's after reading an assignment, whatever it is you're doing, reflect and evaluate. That's step 7. Regularly reflect on what you're learning and evaluate how you feel you're making that progress. Consider how you can approach a situation with a patient. What strategies you're being told will work? Did they work when you were in a clinical experience? And then what could you have done differently? What improvements could you make? Because that's what nursing is going to be about. You're going to try things and you're going to realize that your patient is not responding and you're going to try something else. And then make yourself a note. When you journal information, it's really good for that self assessment, identifying what things that you could have done differently, identifying barriers that kept you from being able to grow in that moment, and then identify how you can continue in that progress of your growth as a nursing student. Embrace mistakes, and I cannot emphasize that um, too much. Okay, as a seasoned nurse, I have felt and made many mistakes and felt to my core I didn't know what to do. But the best place for making those mistakes is going to be in that simulation lab. It's going to be in that skills lab doing competencies. That is when you embrace those mistakes, recognize them, you build within you a sense of humility that says, to err is human. We do make mistakes. But the more I practice this now, when I can redo the mistake and take the mistake back, the less chances there will be to make that mistake on an actual human being. So don't be afraid to make mistakes. Nursing school is supposed to be that safe environment for you to learn and grow. And if you're not feeling that, talk to somebody. Analyze what your mistakes are. Understand the underlying reason and then use that as an opportunity to build on those critical thinking skills. You're going to have to embrace a growth mindset and view these challenges as a stepping stone towards making those improvements. Next, stay organized and manage your time effectively. Nursing school really demands an organizational skill. You have to really be good at it. If you don't have a planner, a calendar, if you don't have an electric calendar, I suggest that you get one. Use your learning management system, whether it be Blackboard, whether it be Canvas, whatever your nursing school is, make it your priority. Every program offers an orientation into that learning management system. Know it frontwards and backwards. Create yourself a calendar. Link your calendars to your phone. Make sure that you're getting those notifications because trust me, to this day, I still practice that as a lecturer, as a nurse, because without it, I find myself feeling a little bit behind and then rushing to get caught up. So, again, effective time management, creating a study schedule, break down your assignments into manageable tasks. If you wait to the last minute, you go back to that type of high school learning that you did where you're memorizing the information and then you're dumping it as soon as you're done. But if you make them manageable tasks throughout a period, if I have 9 days to get an assignment done, work backwards. I say, okay, it's due on this day. I don't want to be working on it that day. So, what how much of this do I need to do? Work backwards. How much should I do the day before it's due? The day before that, the day before that, to act to up going back to the date of that assignment. So if I have an assignment due next Friday and it's the Friday before, I'm going to go, okay, I got a couple of days here. Okay, it's due on Friday. What do I have to do on Thursday? What do I have Wednesday, Tuesday, Monday? What do I have to do on Sunday, Saturday to this Friday right here? Okay, I have this open time. Let me start. And I need to do this, this, and this. And then make that manageable and set that for yourself. Make yourself a checklist. When you make that yourself that checklist, you're checking things off as you're getting them done, you're saving them. And then when it comes time on that Thursday night before that assignment is due, you're uploading it and you're helping decrease that anxiety and stress that you might create for yourself by if you wait till the last minute. And then make sure that you're prioritizing your workload. This is really going to help you allocate the appropriate amount of time for that critical thinking part that you need in problem solving, especially in your assignments that you're being given by your instructor. With self experiential learning opportunities. I feel like this is really beneficial. What I really want you to do as a student is look for opportunities to apply your knowledge outside of the classroom. So, not saying that you have to work, but can you volunteer at a healthcare facility? Can you take time to shadow a nurse or participate in research projects? If you take what you're learning and you engage that in real world experiences, it's really going to help you deepen your understanding of not only the nursing practice, but it's also going to help you enhance your critical thinking abilities. So, whether it, whatever field it's going to be in, take really good notes. One of the things that I want to encourage you, and I hear this feedback from a lot of my students, is that you really want to make sure that when you're engaging in these experiential learning experiences, that you don't use what you're seeing in those experiences to answer questions on your exam. You want to take what you're learning in the classroom and go, wait, this is what they're supposed to be doing. Make those mental notes for yourself, because when you make those mental notes for yourself, you end up changing your mindset to go, when I become a nurse, I'm going to do my best to try to do this the correct way, because this is what benefits my patient. This is what I'm going to school for. I'm going to school to learn a craft that requires critical thinking, reasoning, and judgment to provide the best care for my patient. And remember, developing critical thinking and critical judgment skills is going to be a continuous process. So be patient with yourself, keep practicing, and as you progress through nursing school, you'll find that these skills become second nature and play a vital role in your future nursing practice.